Welcome to this month's Masterclass, all about dark under eye circles. Now, I get tons and tons of questions about this, not only on social media, but also from my patients. Everyone wants to know how to get rid of dark under eye circles. So it's actually really quite complicated. And the bottom line is there isn't really a good solution yet. And there may be one day, but there isn't yet right now. But let's just take a step back and talk about what we do know by looking at kind of the scientific literature and a bit of the evidence base. So in scientific literature, dark under eye circles has a special name. It's called cutaneous idiopathic hyperchromia of the orbital region. Idiopathic cutaneous hyperchromia of the orbital region. But to you, they're just dark circles. So there you go. And there's lots of stuff available to try to use to treat them. Vitamin C, ointments, caffeine-infused lotions and potions, eye creams. Now, you all know what I think about eye creams. What a total waste of money. They definitely won't do anything for your eye skin. You might as well just use Vaseline. So let's talk about what you can or cannot do, but to potentially help them. So the first thing that we need to do is think about why people have them. So one way to diagnose what's happening in the skin is by doing a biopsy. So to take a little piece of the skin from under the eye and potentially compare it to some normal looking skin. So perhaps on the side of the cheek. And that is exactly what some very clever scientists in Brazil decided to do. So a few years ago, they took biopsies from the dark skin under the eyes and the normal skin that's quite to the side of it, lateral to it. And they found an increase in melanin, which is what gives skin pigment or color. They found widening of the blood vessels in the upper dermis of the skin under the eyes, in the darker eyed people, and a decrease in the blood oxygen levels in patients with dark under eye circles. So they had poor circulation in the skin under the eye. And that was compared to the normal skin. Oh, sorry, they took it from behind the ear. So that's quite nice. No scar on the cheek then. So skin from here, skin from behind the ear. And they found an increase in melanin in this skin, which was darker compared to this skin, widening of the blood vessels, and a decrease in blood oxygen. So poor circulation. So now the next question is, now why does this happen in that area? Well, of course, no one really knows the answer to that question, but there's a lot of research trying to figure it out. Because as you can imagine, the person or company who figures out how to treat dark circles is going to be a very rich man indeed, or woman indeed, or company. There is good evidence to show that the development of dark under eye circles is hereditary. So if you have a female relative who has the same problem, you almost certainly will as well, or a male relative. Studies have also found an association between asthma and the development of dark under eye circles. That's another one. Though the reason why that connection exists isn't really clear. But it might be because if you have asthma, you are likely to be atopic, so you have allergies. And some people with allergies can develop inflammation and poor circulation in the skin around their eyes, which is probably a big factor in causing it. If you have chronic inflammation in the eyes for whatever reason, that can also disrupt the pigment-producing cells like the melanocytes in the skin. And this can cause more pigment to be deposited in the skin under the eyes. But there is no strong relationship between like hay fever, eczema, alcohol use, or having acne and dark under eye circles. There's also no evidence to suggest that sleep deprivation is linked to dark under eye circles. So it's not sleep, it's not alcohol, it's not if you have acne, it's not hay fever. So really nothing's been associated with it. Because if you have dark circles, you might find that no matter how much you sleep, nothing really changes that under eye darkness. There is a cultural bias associating dark circles with general well-being, which is probably why most people don't want to have them. So in Japan, there are several words that describe under eye circles, which can also refer to exhaustion or sickness. So if you're in Japan with under eye circles, they think you're sick. But of course, that's actually not the case. So dark circles are hereditary, maybe associated with asthma. We know there's increased melanin in the pigment of the skin. There's poor circulation. But one big thing is your anatomy, so your orbital bones, and that creates shadowing. So if you have kind of pronounced orbital bones, or if you've lost the fat in your orbital area and your eyes are more sunken, then that can create a shadow or the appearance of a dark under eye circle. And that would require tear trough filler, for example, to try to smoothen out that crevice that can be created there. That's using hyaluronic acid. And that's one option. So there is some evidence to show that hydration can have an effect, but it's really short term because your body is really good at regulating its hydration levels unless you're really sick. But yeah, I mean, making sure you're drinking enough water can be helpful in improving the appearance under the eyes. And also looking at your wee, your urine should be a light yellow color. That means you're fairly well hydrated. And there's also been some studies that looked at the severity of the dark under eye circle being directly related to the contrast between the darkened under eye skin and the surrounding cheek skin. That's pretty obvious. So if this is really dark, but you're very fair, then it'll become more obvious. So trying to match your under eye skin with your cheek skin with makeup is not a bad temporary improvement, but I'm sure you already know that. So basically, dark under eye circles are a cosmetic nuisance, but there's no way to get rid of them permanently. Make sure you drink enough fluid, perhaps, get rest. If you have a deep set eye with a pronounced tear trough, you may benefit from tear trough filler. But really, I would say when patients come to see me, it's like 1 out of every 10 patients is a candidate for tear trough filler. You really have to be careful with choosing the right patient because most people, in my opinion, are not candidates for tear trough filler, and especially not for dark circles, because it doesn't improve the dark circle, but it can create less of a shadow. So there's not much to say. I can't give you a magic cream or a magic treatment that will make the dark under eye circle go away. There isn't anything out there that does that. No amount of carboxy therapy, dermaplaning, or derma rolling will do anything for hereditary under eye darkness. So that was kind of a depressing masterclass in the sense that I haven't given you a good action point besides investing in good foundation or concealer. But there is no good treatment for dark under eye circles. I'm so sorry.